Good afternoon, everyone, and welcome to our eighth and for now final installment of Equity in Action. My name is Tom Strong. I am the National Fund's Director of Employer Activation, and I co-lead one of our programs called CareerSTAT, which is the National Fund's healthcare sector strategy. CareerSTAT is a key part of the work that we do to activate employers and make jobs better. And this series highlights CareerSTAT's peer-led Frontline Healthcare Worker Champion Recognition Program. We relaunched this program last year, and we were really thrilled to recognize 8 organizations that are creating great jobs, building equitable workplaces, and making significant investments in the skills and careers of frontline workers in healthcare. This series, Equity in Action, is our way of inviting you into that conversation. You're going to get a taste of what programs and the practices that champions have in place. There will be some future opportunities still for CareerSTAT members to take a deeper dive, including at our conference, which is later this month and which I'll have more to say about soon. For now, I encourage you to jot down your questions, and we will have a good Q&A time at the end of this session today. In today's episode, I am very delighted to be speaking with Cynthia Bailey, who is the Associate Director of Workforce and Career Development at Atrium Health. Cynthia, welcome and congratulations.
Thank you, Tom.
So throughout this series, in the interviews that we've done, folks have started off by sharing a little bit about their personal career path. Can you share a little bit about how you came to be doing this work?
Sure. So what I know and what I've learned over time is that HR is my home, but HR is also a home that has many different rooms. I started as an administrative assistant in HR for a government agency. And then after earning my undergraduate degree, I went on to become a coordinator in a organizational development role, which was sort of workforce development type work. So these are my roots in workforce development. But I always had this desire to go on to be a criminal defense attorney. This is something that was in me since childhood.
Oh, wow.
Yeah. So working in HR, I graduated from law school. My law school experiences and internships quickly shifted my desire to become a criminal defense attorney for various reasons. But I continued to work in HR. So I had the luxury of going to school and working at the same time, able to get exposure to different areas within HR, including employee relations and labor management work. So as I gained that experience, I learned something else about myself, that I gravitate towards roles that uplift employees or help them be the best version of themselves. And what I found that when you do that, the business ultimately does better. Happy employees translate into better outcomes for the business. So then again, shifted my work to healthcare HR. I went from government to healthcare as a wellness manager. And that's actually what brought me to Atrium Health more than 11 years ago. And so working in that field for a little while, there became an opportunity for a new workforce development department being formed at Atrium Health. Because that's my roots, I jumped on that opportunity. I am here back doing the things that I love as far as helping employees just really reach their full potential and also serving a business need.
I love that. And thank you for sharing your journey with us. It underlines something that we see a lot at the National Fund, which is just that for the people who work in workforce development itself, like there is such a diversity of backgrounds. There's so many ways to come to this work, but we really also are united by this shared mission.
Mm-hmm.
So you've been with Atrium a good long time, and Atrium is an organization that has invested deeply in its workforce over the years. Can you tell us a little bit more about how Atrium as a system developed this strategy and how it's been informed by engagement with the community?
Sure. So many years ago, there was a teammate satisfaction survey conducted among all of our staff. And every year we do these employee satisfaction surveys. But one of the questions on this particular survey asked teammates, were their basic needs being met? And the results were surprising. We found that almost a third of the respondents who are working employees at Atrium Health, they were still struggling with some of their basic needs. Essentially, they were working poor teammates, and we took that very seriously. Around that same time, there was a national study conducted. It's called the Chetty Study about economic mobility among large metropolitan cities. Charlotte, the city where Atrium Health is based, was ranked 50th out of 50 cities. So we were the worst for according to that study of metropolitan cities. So that study has recently been updated. Disclaimer here, we are now 38th out of 50, but we still have work to do, and we are doing some of that work. We have a robust community and social impact team. So they've developed partnerships to help our teammates who are facing some of those hardships. So since that time, we now have a housing program where we partnered with over 9 different apartment complexes in the Charlotte region. And those apartment complexes offer income-based housing for our teammates. We also have partnerships with home ownership agencies and financial literacy educators to also help individuals who don't want to be renters, they want to be home owners, and how do they navigate that? Because I do believe also that home ownership is a part of the economic mobility narrative. Mm-hmm. They also set up the teammate emergency fund. So oftentimes catastrophic events can send someone into poverty if they don't have a savings built up. So we have that available to our folks as well. We offer transportation and lift passes to our teammates. We have a food pantry. There's also opportunities for our teammates to get free produce from a local farmer's market. So those were just some of the basic life needs programs. I'm a firm believer if people don't have their basic needs met, it's very difficult for them to show up to work the way that they need to. But then we also had some workforce development programs that we realized we needed to take a look at as well. We traditionally had tuition reimbursement for teammates. And again, some teammates, especially our hourly workers or our teammates who are lower paid, could not pay up front and then wait several months to get reimbursed for their tuition. So we implemented prepaid tuition assistance. Mm-hmm. We also have a program for some of our high school kids, just a career exploration for kids in Title I high schools or who are eligible for free and reduced lunches. We have a career exploration program for them, and then we begin to expose them to the different careers and encourage them to come back for internship and encourage them to come back for some of our other career pipeline programs to just get them in the door of healthcare. Another program which I'm really excited about because I feel like this one had the greatest impact when you talk about workforce and individuals as well is our RN Educational Assistance Program. So that one was created, it was actually created by a nurse years ago who recognized there was a need to look at our frontline teammates who are under a certain income level to become a nurse. For those nurses or healthcare professionals out there, you know that individuals often have to quit their job or bump down to part-time or, PRN status, which is our sporadic scheduling status, in order to go back to nursing school, just the rigor, the way that nursing school works. And so this program was designed to pay these individuals to keep them at their same level of pay and benefits while they're going to nursing school. And so hourly employees also, they don't have the same flexibility as exempt teammates. And so we recognize that the paid education time has been that's probably the best benefit in addition to the tuition assistance that's provided for it. The paid education time, I feel like, is really the essence of this program and what has really helped some of our frontline employees move from a frontline salary to nearly doubling their salary when they become a nurse.
Well, first of all, that's a really impressive spread of programs. And I know we at the National Fund were quite impressed by just the depth and the breadth of the work that your team does. I'll say that I love how some of these programs kind of intersect and support each other. Like I can definitely see, like with doing prepaid training, tuition remission, how that can potentially support some of the financial education, financial literacy work, for instance, since that is such a tension for lower income workers. It's great that you're doing both those things at once.
Thank you.
I'd like to ask you about another program where I think your organization has really taken a lot of leadership, which is in the field of fair chance hiring. You're well known for a program called Restorative Pathways in this space. Can you say a little bit more about what fair chance hiring is, what compelled your organization to develop its approach, and how you've implemented it?
Sure. So the way that we look at fair chance hiring is the practice of hiring or considering a qualified candidate for a position without solely basing the hiring decision on their conviction record. At Atrium Health, we don't ask for an individual's criminal past until after we've interviewed them and we are ready to make a conditional offer of employment. The question has to come up. It's part of working in healthcare. We are highly regulated, so it's just not a free-for-all, but we try to focus on the skills that they bring first and then deal with the background questions and things later. We know that individuals with a criminal record face incredible barriers to gainful employment and life-sustaining wages. So while they're able to get temp work or gig jobs or little jobs who have little or no benefits, we were looking for a way to kind of disrupt that, to give these individuals an opportunity at sustainable wages. And the way we approach it as a healthcare organization is that poverty is a social determinant of health or a driver of health. When individuals can't pay their bills, when they can't have a roof over their head or food on their table, they tend to not be as healthy as we like. And when they can do those things, they have better health outcomes. So this second chance hiring program, we want to give people who have faced barriers to employment, face barriers to opportunities for gainful employment, hopefully one way to lift them out of poverty. So our program started at the very top. Our Fair Chance Hiring Program began in 2021. It was the result of a challenge from the mayor of the city of Charlotte to our CEO. Atrium Health is the largest employer in Charlotte. So he took that challenge to heart, let me say. And so he asked, he came back to the HR team, workforce development, and he asked that we begin a fair chance hiring program. That's really how it got going. Now, a lot of people, want to start the bottom up, but when you have your CEO saying that he wants a program and giving you full range to do all the things and check off, meet with legal and the HR teams and all the people, compliance, to make it happen. It made it very easy for us to kind of walk through that door and make the program happen. We partner with the local community organization who is already in the work of reentry. Their name is City Startup Labs. They already had extensive experience supporting those individuals returning home. That community partner, they source and they vet our candidates for us. They then present those viable candidates to us for interviews. And then we interview them for a 5-week paid internship where they're getting workplace readiness training. If they're successful in that training, then we go on to interview them for a full-time permanent benefits eligible role at Atrium Health. So that's the high level way the program works when they come in the door. But once they're here, we offer them support services. So they're assigned an accountability partner. We have employees who also were interested in this program, maybe not just as involved, but they were so excited. This is another employee morale booster, is they were so excited to work for an employee who had this type of a program that they volunteered to be mentors to individuals coming through the program. Atrium Health is a very large organization, 150,000 teammates. And so the mentors make it a lot smaller for these individuals to kind of transition from the training into their role and just navigating all that goes on in a healthcare organization.
Oh, it's a really impressive program. I'm sure folks in the audience would love to know more about how it works and how you've built up internal buy-in for it. It does sound like you had a lot of leadership commitment from the start, which probably helped, I'm guessing.
Mm-hmm.
Are there other kind of, I can see the intentionality with which you built this program, but if another organization was trying to get started doing this, would you have any advice for them?
Yes. So usually these type of programs have to come out of HR. The Society for Human Resources Management, who is pretty much the gold standard for certifications within human resources, they have really leaned into this space with their Getting Talent Back to Work toolkit. I highly recommend any HR professional that is looking to start a fair chance hiring program to go and check out that toolkit and the resources that are available there. And start to have the conversations with your legal team, because again, the risk tolerance for some organizations might be different than what it is for Atrium Health. I was sharing earlier, if healthcare can do this, where we're working with vulnerable populations, all sorts of individuals are coming in and out of our hospital 24/7, 365 days a year. I think it's just asking the tough questions of your legal, compliance, and HR teams to get them on board. I think Atrium was, I'll just say it, I had an affinity towards this work because of my law school experience. I wanted to figure out a way to help people returning home to get back on their feet, because there's this revolving door. When they come home, they can't get a job. They can't usually, in some instances, even get housing, because apartment complexes won't allow you to rent there if you have a certain background. And so what started to happen is recidivism, or people were returning to prison because some of them were kind of in a hopeless situation. And so I just think it's important for us to try to think outside the box, talk to your legal teams. There's also a really good book that I read before kicking off, because again, I just tried to really, I guess, get immersed in all the research about fair chance hiring. It's a book called Untapped Talent that's out there. It is by a banker or financial guy. He's talking about the business case of fair chance hiring for employers, because while it's great, we're helping, people get on their feet and great for their community, he comes all in with the business and the money side of why this is an important initiative.
That's fantastic. And we'll make note of those resources for listeners. Untapped Talent, and I think it was Getting Talent Back to Work.
Yes, from Sharm. Yep.
Really appreciate all your insight into that topic, Cynthia. Couple more questions, a little bit quicker. You've mentioned previously your pay to train programs. I can see there's always some interest about that from the audience. One of those that we talked about was called Rise to Success, which I think is the next step for young people that you are working at getting into your system. Can you just tell us a little bit more about that program and how it works?
Sure. So our Rise to Success is a program for high school seniors who are about to graduate. It's an alternative to immediate entry into a 4-year university when they graduate from high school. So students are given the opportunity to begin working at Atrium Health upon graduation from high school. Some students are graduating with their certified nurse aide license, so we can put them right to work that summer that they graduate. But some will go on for community college. We will pay for their community college education to get an associate's degree. And we have very targeted roles. Some of our more in-demand roles that they can earn an associate's degree and certification and get right to work within Atrium Health. So we're paying for them to go to school. We're also paying them to get exposure in the field as they work. what we have also learned, some kids and oftentimes it's the parents, they kind of are not as in tune with a community college or associate's degree, or everyone wants to go straight into that 4-year university, and I completely understand that. But what we tell for some of those other high school kids that may not be on that trajectory is try the Rise to Success program, get that associate, get that healthcare certification. Once you become an employee, now you can tap into our education benefits. So if you decide to go get your bachelor's degree, if you decide to get master's, your doctorate, whatever you want to do after this, we can financially support you, and you can avoid some of that student loan debt that so many of us have had to have in the past.
That's really cool. It sounds like another great program.
Mm-hmm.
Related to that question, we have a question from the audience, and I do want to start segueing into the Q&A now. So April Harrington asks, I love that prepaid education programs for nursing. Is that available to all frontline positions, or do they need to meet certain requirements?
So they must meet certain requirements. It's a competitive process. So once a year, we open up the applications for our frontline teammates who meet the criteria. They have to earn under a certain amount of income. We accept all types of positions to apply. But they have to have their leader's recommendation. So we're talking high performers in frontline roles are only eligible for that. They complete an essay question as well. That we have a team that looks at that information, and then out of that, we're able to select who our top candidates are for the program.
Awesome, thank you for that. I want to invite other questions from the audience now. We have about 4 or 5 minutes for them. As they come in, I'm going to ask you one more lightning round question, Cynthia,
Okay.
Which is, in recent years, you've begun kind of exploring more formal registered apprenticeship programs. And I'm just curious, what kind of careers have you focused on with that so far? And do you have any lessons learned from the process?
Yes. So we have just recently, for the past 3 years, we've had an LPN, licensed practical nurse. It's sort of the midway between CNA and registered nurse. There's the LPN. We have a partnership with the local community college where we've had 3 cycles of the LPN apprenticeship program. It has gone very well. Having that community college as our education partner has really helped a lot. We also had a surge tech apprenticeship about 2 years ago. That one was, while we did well, a lesson learned out of that is we needed to pull from students who are already accepted into these programs. So surge tech program, LPN program, they all have prerequisites. Even though you're accepted into the college, you then have to meet another set of criteria to get into those healthcare programs. And so I think, lesson learned there is, go to the students who are already accepted and have already met the criteria of those programs. I even like having the community college as my partner in the apprenticeships because, again, they're walking alongside the student. They're making sure they have all the access to the student success resources to help them achieve their goals of graduating and all of that. We, in North Carolina, we have what's called Apprenticeship NC. It's an office who kind of oversees all of our registered apprenticeships. So again, using my representative for registered apprenticeships has been extremely helpful for us as we've launched, and hopefully in the next year or so, we will be launching more apprenticeships.
That would be incredible. I have heard a lot of good stories in general about kind of apprenticeships in North Carolina being a growing area and an area where there's a lot of traction right now. One of our sites in Greensboro has also built an impressive array of apprenticeship programs, although I think more in manufacturing.
Yeah, manufacturing and the trades, they seem to have it down. I think healthcare has been a little slower to adopt the apprenticeships, but we're warming up to it more and more, and hopefully we'll be growing those in the years to come.
Yeah, and as a plug, Cynthia will also be at Shift, our national convening, which is in Memphis, September 24th through 26th. And we're going to be discussing all of these topics then as well. We've got an Employer Affinity Day on the 24th, and registration is still open. We're above and beyond the total number of people we were looking to have at this conference, but the response has been great. But we will continue to have registration open until this Friday if people are still out there who would love to attend. We have another question that came in. So many great programs for providing financial support for education and career advancement. Can you share more about how those programs are funded, through grants or public funds, or operational, or a combination?
A combination. So yes, we, in fact, our art and educational assistance program that I was speaking of earlier, when we started the program, we were only able to offer that because it's such a benefit-rich program. We were only able to do that to about 10 to 15 teammates per year. We were able to secure a grant that helped us bump that from 15 all the way up to 50 recipients. So we work closely with our foundation to garner other, financial means. So yes, but then a lot of these programs, they're based out of the operational budget of Atrium Health as well.
That makes a lot of sense, especially given kind of the regional mission to improve your standing and improve economic mobility, which moving up that much in such a short amount of time is truly impressive.
Yeah, and I think too, the pandemic really shed light on the shortage of healthcare workers and just the impact that it had. And I still think we're to some degree still recovering from some of that hit that happened at that time. And so a lot of the grantors recognize that and were willing to help us staff up or offer programming to really make healthcare more attractive again.
Yeah, I can totally see that. And that has definitely been a theme that we've heard from other CareerSTAT members and champions in this series, how much that has reshaped our thinking around some of these societal challenges even now. Yeah. So we're approaching the end of our time. If there are any more questions, I would say get them in now. I'm going to make a couple more announcements. First of all, we are excited to say that we have written up profiles of both Atrium and all of the 7 other CareerSTAT champions and emerging champions this year. We will share that link in the chat, and copies of the profiles will also be available for folks in our conference app when you come to Shift. We want to give a big thank you to our funders at MetLife Foundation, who supported the CareerSTAT recognition program this year, as well as the development of these profiles, as well as to our general funder, West Miriam Asefa Fund, for their ongoing support of CareerSTAT. Again, we're really excited about Shift. There's going to be a lot of opportunities to connect with both the champions and other CareerSTAT members. We're anticipating over 50 CareerSTAT members will be at this event. And we will have a big and involved Employer Affinity Day at the front of it. If you are listening to this and you are not yet a CareerSTAT member, please join CareerSTAT to stay in the loop, and we will share a link for joining CareerSTAT. As long as you work in healthcare or you work in workforce development with healthcare organizations, you are eligible to be a member, and it is free. So with that, I'm going to pause and see if there are any more questions. And if not, Cynthia, thank you so much for this interview today. Look forward to seeing you at Shift, and thank you for all you've done as a CareerSTAT champion.
Thank you. I'm looking forward to it. Thank you for the award.
Hope everyone has a wonderful afternoon, and we look forward to seeing many of you soon.